Good. It's good to see so many faces. This is definitely a topic of great interest. And what's really kind of unusual about it is that we're not going to hear from a physician. We're going to hear from someone who's had an extensive background in clinical care for people with Parkinson's and has an occupational therapist viewpoint. And from what I have in working in facilities where occupational therapists worked, what I have found is they're the ones who take a look at an individual's life and say, okay, what's going on in your life? What would you like to have that you better? What can we do to make some adjustments so you can continue to do the things you want to do? And what have you never done before, but would like to try to accomplish? So I'm really happy to introduce Julia Wood. She's the Director of Professional and Community Education at the Lewy Body Dementia Association, has a master's in occupational therapist, is on the faculty of LSVT, is team training with the Parkinson Foundation. So not only is she an expert in occupational therapy, she's also a wonderful teacher for other people to learn about working in that field. So I want to welcome you, Julia. And thanks so much for being with us. I also want to introduce Kelly and Samantha. There's Kelly's waving, and there's Sammy, she's waving. They're on staff with PMD Alliance, and they'll be helping on the technical side so that if you all have any problems with Zoom or whatever, you can chat and we'll see if we can help you immediately in one way or another with whatever problem you may be having. I'm Judy Talley. I'm one of the co-founders and the current director of community education for PMD Alliance. And so I am really happy to have this opportunity to speak with all of you and see so many faces again as we go about learning about dementia from a kind of practical living the life perspective. And so one other thing, just some house cleaning. We are recording the session. It will be available probably sometime tomorrow, if not the next day for sure, on our YouTube library. And what I know that you all may have questions. What I'm going to ask is if you will put your questions in the chat down at the bottom of your screen. You'll see there's a little chat icon. Put your questions there. And we have such a large crowd today that what I'd like you to do is put the questions there. We'll hold them until the end for Julia, and then see if we can kind of make those questions work. I'm sure some of them will be similar, some will be unusual. I doubt we'll get to all of them, but definitely want to see how we can make those questions the most useful for the most number of people today. So Julia, I'm going to turn it over to you and say, welcome. We're so glad you're going to talk to us now. It's all yours.
All right. Thanks so much, Judy. And thank you, Kelly and Samantha, for being here for support. And thank you all so much for joining me. I recognize some familiar faces in the crowd, so thank you so much. And happy Parkinson's Awareness Month. So we're going to be talking about cognition today, and hopefully from a standpoint that will maybe ease some fears and give you some practical things that you can do. So I'm going to go ahead and share my screen now. Okay. And then I'll go to my slideshow and we'll get rolling. Okay, so as she mentioned, I'm the Director of Professional and Community Education at the Lewy Body Dementia Association. We will get to dementia toward the end of the presentation, but we're also just going to talk about different aspects of cognition and Parkinson's today as well. So my objectives for you today is that you'll understand approaches to cognitive rehabilitation and really what that means, because that's there's a lot of misunderstanding often in the community about what it is. We're also going to describe the role of occupational therapy, because it's also OT month, in managing changes that you might be experiencing with your Parkinson's disease. And then I really want to make sure that you feel like you understand some strategies, some aids, maybe some ways to cope with different changes that you might be having to maybe some or all of these different domains of cognition, including memory, attention, visuospatial function, executive function, and word finding. And we're going to get more into what those mean as well. And then we're also going to talk about brain health activities to support your cognitive wellness and your quality of life. There's a lot going on in the media about brain health. And so we'll talk a little bit about that. All right, so what is cognition? I wanted to start by defining this because I think that often it's mistaken as being intellect. So people think that, I've had some people with very high level PhDs, very intelligent people that have spent a lot of their life educating. And so when they hear the concept or, the words cognitive impairment, it's like this loss of intellect. And it's actually quite different. So cognition is just a general term that refers to your mental abilities that we use to process information and apply knowledge. So if you think about your computer, right, you've got all these files in your computer. So you could think about those files like knowledge that you've stored over the years that you've learned. And those files don't go away. What changes a lot of times with different elements about cognition is getting to the file. So it's the retrieval to process that information and then how to apply it. So it's like when you go to open, a window on the computer and you get that spinny wheel, the information's there, the website's there, the information is there, it's not gone, but it's harder to access and process it. So think about in your Parkinson's, how things are slower, right? We have that bradykinesia. There's also a term called bradyphrenia that we'll get to later, that slower thinking. So, I like to talk about it almost like everything's slowed down. If you've ever had a slow internet connection, it's kind of like that. It's still there. It's not that your brain doesn't work. It's not that you're any less intelligent than you ever were. Just like your movement is slower, your thinking and processing can be slower as well. So these mental processes that we're talking about allow us to perform our daily task or daily functions. So paying attention is really rudimentary and kind of underlies everything. For example, if I meet you at a party and you introduce yourself, but I'm looking at the tray of drinks going by as you tell me your name, I'm not going to remember your name probably, right? Because I wasn't paying attention. Same thing if you're doing a more complex task like cooking or baking. If you're not really paying attention during a step, you can make an error. Performing daily tasks is part of these mental processes too. So we forget how complex we are in following steps, order, procedure, routine memory. So, a lot of things can impact that with Parkinson's. Another one is finding the right word in a conversation. So that word finding. Some of you might have experienced, it feels like the word's right on the tip of your tongue, but you just can't quite bring it forward. And then also solving problems or doing more complex tasks. So this is really what we talk about is it's not really what it's how you're able to apply it and how you're able to retrieve the information. So think of it that way. Nobody out there is any less smart. So what is occupational therapy? I get this a lot. In fact, I had a gentleman early on. I tell this joke so much. Many of you may have heard it. He came into my office and he was pushing 90 years old. And I said, have you ever seen an occupational therapist before? And he said, I never have. And I haven't had a job in 60 years and I don't want one. So it's like, I don't know why I'm here today. And that's true. A lot of people think it really relates to paid work. And that can be something that we do, but it's not all that we do. So occupational therapy is a form of therapy where we encourage rehabilitation through the performance of the things that you need to do in your daily life. So if you think about the simple task, we might have thought it was simple before Parkinson's, just of getting dressed. There's big movements that you have to make. There's memory, there's reaching, low reaching, high reaching, maybe getting the clothing sorted right, matching colors. So all of those things, we believe as occupational therapists, really have a relevance and are therapeutic in our life. And once you give up those tasks and someone starts doing it for you or assisting you with it, then when you lose some of that, therapeutic benefit of that activity. So we really also have a holistic perspective. And this is so important to know because often, I will admit, I feel this gets lost in occupational therapy sometimes in some clinics where maybe there's a push for different types of billing or different types of therapy to be done, where we believe you as the client and your care partner are central. And what we have to do is focus on adapting the environment or the task to fit you. And it should be something that's meaningful to you. So that's basically what we do. Like Judy so beautifully said in the beginning, we want to help support you in whatever it is you want and or need to do. So when we talk about this relative to cognition, because there's a lot of different people in a healthcare team that might look at your cognition. Maybe your physician or neurologist has done some type of a clinical screening on you. Maybe you've been to a neuropsychologist before and had more of an in-depth testing. Nurses sometimes will look at your cognitive ability, but what we're really looking at is your functional cognition. So how does your thinking impact your everyday task performance? And this could be in your self-care routines, maintaining your household, cleaning, cooking, doing things at work even. So early on, a lot of times people have trouble with multitasking. And so that might be a domain that we really address. We specialize in identifying performance-based cognitive impairments, and they could be very subtle to very obvious, but really masters at looking at what are the barriers that are getting into the way of you doing what you want or need to do. We treat these cognitive impairments using evidence-based methods because they have the potential to compromise your safety as well as your long-term well-being and quality of life. So this really does fall within our domain and scope. And so I hope this helps you today understand a little bit of, if you go to an OT to address cognition, what to expect. So when we're doing that assessment, it's really important, like I said, that you are the center of the universe. So we want to develop what we call an occupational profile that looks at your participation. So what types of things do you need to do for your daily self-care or maybe your home maintenance or, to socialize or engage in things that you find fun. And we're going to look at your patterns, your routines, your roles in those. But we also really want to think about your values and your interest. So a really good example of this is sometimes people will come in with Parkinson's. Maybe your handwriting isn't so great on an intake form. Well, and often a therapist will be like, well, we're going to address handwriting. Well, not if you don't want to. If it's not meaningful to you, it's not meaningful to us. So we want to identify your areas of concern or where you're having difficulty in your daily activities. Then we're going to collaborate with you and your family, if that's relevant and okay with you, to prioritize what your goals are for therapy. And there's more and more evidence coming out that shows that that is the most key component of rehab and self-management in Parkinson's, is that it's about your goal, right? And it's meaningful to you. So I wanted to start with this article that I love a lot. It's a report from a symposium that they did talking about cognitive health, also talking about different aspects of cognition in Parkinson's disease. And it really gives some great, I think, guidance that we can discuss here. So you'll notice here that in this early stage, which is kind of these top 8 points here, what they recommend for early to mid-stage Parkinson's, there it is, exercise, right? You should have known it's the first thing that's going to come out of somebody's mouth when they come and talk to you guys. And the ACSM has a great guideline, American Heart Association for, adults. There's also a new ACSM recommendation that has come out on exercise guidelines for Parkinson's that you can take a look at as well. The pandemic, if it taught us nothing else, people need to stay socially active. This is so, so, so important. So spending time with your friends, joining a support group, getting into online or in-person activities. There's so much of our cognition that is really tasked when we interact with people. Engage in cognitive training exercises, and we're going to talk more about what that looks like. And I love this one. I had to highlight to learn coping strategies with an occupational therapist or neuropsychologist. Nutrition, there's some evidence for that. So they encourage people to try a Mediterranean diet. And you can look that up, but basically it's a whole foods diet that really limits your refined foods. So whole grains, fruits, vegetables, lean proteins. One we're going to talk about a little bit today is taking your time when doing tasks, because we know that everything gets a little slower with Parkinson's. And if you get time pressured, that can really impact your ability to think in the moment. And then this is so important to remember, you guys, and I believe anyway, or feel that the pandemic has hopefully brought our culture and our society to a place where we're more accepting and understanding of mental health conditions like depression and anxiety. So if you are having symptoms of depression or anxiety, please talk to someone about it and get help. It really can impact your cognition as well as your motor symptoms. So don't ignore it. There's no reason to feel have any stigma about it, because just like there's loops in your brain that dopamine is a part of that regulate your movement and your thinking, there's a loop in your brain that dopamine is part of that impacts your mood. So it's part or parcel with Parkinson's for so many. You'll notice at the bottom here, there's some recommendations if you have more advanced Parkinson's disease. So they tell you to keep doing all the things on the top, develop a highly structured daily routine that you follow, talk to your doctor about medications, have an advanced directive in place. And then you'll notice these last two are for care partners of making sure to take care of your own health as well and seek out counseling support if needed. So out of these tips, the ones we're going to focus on today is this engaging in cognitive training exercises. As I mentioned, we'll get to that. Also, what these coping strategies look like. I'm going to try to give you some solid examples. And then lastly, that taking your time when doing tasks. So we'll talk about that time pressure component as well. Okay, so let's talk about cognitive rehabilitation. Because there's a couple of different approaches here. And often what people think of is cognitive restoration. So what that is like a repetitive practice of a task on a targeted cognitive process. So let's say memory or attention, with the goal of strengthening that process and improving functional performance. So this could be pencil and paper activities. This could be computer-based activities. At one point, a lot of people were doing different computer games and things. What they found, unfortunately, is that they see some small short-term benefits that have been shown for people with Parkinson's, but they don't seem to translate to everyday function. So you might test a little bit better on something they tested you in, but you don't really notice it impact or help you with anything in your life. What has been shown and suggested to improve some function is more of a strategy-based approach. And so this is where we provide approaches for accomplishing a task or an activity, despite whatever issue you're having with your cognition. So we really kind of work around it and compensate for it. And often we're training and using more kind of metacognitive, where you have these strategies where you're aware of and kind of analyzing your task performance, maybe problem solving or compensating for different deficits, and learning really to cope with the cognitive changes and challenges that you might have while continuing to do the things that are meaningful to you. Okay, so let's start with executive function. And the reason I wanted to start with this one is even early on. So if you can think back, maybe when you were first diagnosed with Parkinson's, this is often the area for people that's problematic, because I think of it like this. I think of cognition like different parts of the brain trying to talk to each other to do something, right? And the way they talk to each other is with neurotransmitters. So executive function, there's a whole lot of talking that's got to go on, because you're talking about the ability to plan, organize, initiate, and regulate behavior. So this could be following a recipe, building a piece of IKEA furniture, following steps to do a task. And so there's a lot that goes on, right? We've got to pay attention. We might have to shift our attention between things. There's visuospatial function that may come into play. So there's a lot of different elements that apply to executive function. And so even early on, this often impacts multitasking for people with Parkinson's, work tasks, things of that nature. So as I mentioned here, it's that problem solving. It's how you organize to perform a task, how you initiate a task. Regulating, is the task done? What other steps do I have to do? What do I need to do to complete it? Like I said, multitasking and even switching back and forth maybe between different elements of the task. And so there's some different strategies that can really help with this. And this is something that I recommend, whether you're really having a lot of issues around executive function with your Parkinson's, starting to get in the habit of being a little bit more methodical and intense about things that you want to do, I think can really help moving forward as maybe multitasking gets more difficult. So number one is just to step back. So you don't want to dive in head first. You want to kind of step back and look at the problem, look at the situation, really plan, what you need to do. So then we've got to problem solve. A great thing to do is look at possible solutions. So there might be different pros or cons to different ideas that you had. I'm going to give an example in a minute of how this can apply to a task. So, kind of really using some mental flexibility and saying, what are different ways that I could approach this problem? And then making a plan. So a gentleman that I worked with early on who wanted to build a koi pond at his house, he drafted a plan. He was never someone that wrote down anything when he had to do it. He always just did something. And I know a lot of you might feel that way too. But he drafted a plan. He made his list. We worked on that together. He was able to check off his items when he was done. And he built the koi pond completely independent, just with, having a more methodical plan. Then check and double check, monitor yourself, adjust your plan as needed if something's not working. Maybe you need a little different approach, or maybe you missed some steps when you made your plan and need to reframe. Pay attention. This is always underlying all of them. So that could mean removing distractions. Maybe you typically have the television on or music playing when you do some things, or the phone, your ringer's on. You might want to remove those distractions if you really have to concentrate and you're worried about your ability to perform the task in full. Take breaks. Just like you notice that you may get fatigued physically when you're doing things for a repeated amount of time, you can become cognitively fatigued as well. If anybody who's stared at a computer too long or been on Zoom too long definitely has felt this. So taking a break, maybe taking a little walk, coming back to the task when you feel a little fresher can help so much. Be tidy and organized. So clutter, your workstation's not being set up, that can really be a problem because it's a distraction, right? It's harder to organize yourself and your space. And then break it up, approach each of these, kind of steps or of a task just one by one, and make sure you complete that step before you move on, because that's a real problem a lot of times is people start a lot of projects or a lot of steps, but don't complete them. And then I think this is so important. If you have a friend, a care partner, a relative, anyone that you feel like might be a fellow person with Parkinson's, that you feel like you can ask for advice to give you feedback, like, hey, I'm trying to build this koi pond and I got to this step and then I'm kind of stuck. I'm not sure what I need to do next. And see if you can have someone kind of help you, look at your plan and get some more ideas around it. So I put this example here. This was a client that I worked with early on that she came in, and a couple of things I want to point out. She was an avid baker, but all of a sudden she was baking flat cakes. Well, I don't know if any of you bake, but nothing's more frustrating than going through all that time and effort and sometimes expensive ingredients just to have a hockey puck at the end. And she was pretty convinced that she had dementia because she was having problems with this, but it actually turned out she had a whole lot of anxiety, you guys, like a lot. And so that was really more of her problem. So I wanted to kind of sideline that I worked with her on this strategy, but we also worked on managing her anxiety because that was underlying a lot of her cognition as well. But the way we approached baking was had her gather all her ingredients and tools first, right? And then you'll notice here, there's the recipe over on the side. So I had her check all the ingredients off the list. Once she had them out and pre-measured, like you see in the picture here, maybe in little bowls or whatever ramekins, she crossed them off. So she knew she had her ingredients. She was ready to go. It helped her to separate into two workspaces. For those of you that bake, this will make sense. So one space was wet ingredients, one was dry ingredients. So it helped kind of make it a little bit more clear. You'll notice I have a sticky note on the page that blocks the text so she can see the step that she's on. So once step 2 is complete, you can cross it off. I like to add the whiskey. There's the good part of the recipe. I'm teasing. So then you could cross that off, move that Post-it note down and go to the next step. And then being sure too to cross off those steps as you go. So you see how we're still baking, right? She's still making a cake. In fact, she made her husband a beautiful birthday cake doing this. And it might take a little bit longer, but would you rather spend more time and do it right? Or go in there flying by the seat of your pants and then have a hockey puck that you wouldn't want to serve to anyone? So this is just an example of taking something you love and approaching it a little bit differently. All right, so I wanted to point this out because I think this is such a great kind of simplified way to approach this. So this was a feasibility study. And what that means is they tried a strategy with people to see, is it feasible? Does it work? Does it help people if they do this? And so this was a case series that focused on individualizing strategies like we just did, with the cake, to something the person liked to do for people with Parkinson's who had subjective cognitive decline. So that means if you did a MOCA on them or some kind of screening, they didn't show any cognitive decline, but they perceived they were having differences. And early on, that's so common because only you know your baseline. Only you know how easy it was for you to bake or do the banking or balance the checkbook, right? And so it might not show up in a MOCA, but it doesn't mean that you're not having a different experience. So they emphasized self-monitoring and self-evaluation. So they asked somebody, what challenges might you run into with this activity? So with the baking, right, she was leaving out ingredients. Sometimes she missed the leavening ingredients in the recipe. That's why it was flat. So then you're able to kind of talk through, oh, well, I've missed the leavening ingredients in the past. I might miss some ingredients. So thinking about ahead of time, what might get in my way? And then they encourage people to self-generate or kind of come up with their own strategy. Is there anything you could do to make it easier? So looking at a task and thinking, how could I approach this in a different way? And that's where a lot of times I feel it's important to know an OT can come in here because sometimes it's hard for you to figure out, like, how could I do this differently? And that's where you might need some help. But I encourage you, the next time you're having trouble with something, think of these two questions. What challenges might I run into? Is there anything I could do differently to make it easier? Okay, then looking at time pressure management. And you guys, this is so important because we all have, in OT, we call it temporal organization, or we have this time concept. So for example, you probably know how long it takes you to get ready and get out the door to go to an appointment. Well, now all of a sudden we've got all the Brady's, the Brady bunch, as I call them, Brady Kinesia, Brady Frenia, everything's slower. And so it takes you longer, but a lot of times we're not aware of that. So some things that you can do here is this is a compensatory strategy to really look at that time pressure in a real way. But you've got to recognize the need for change. So you have to look and go, wow, I'm really not managing my time well. I'm pressured to get out the door then. I'm getting upset. My tremor's getting tripped up. I'm late to appointments, whatever it might be. And it's going to require awareness to recognize that you're going to have to kind of anticipate and think ahead of time pressure in different situations and identify different strategies to use. And then you got to be motivated to learn the strategy, right? It's not just me telling you what to do. You have to want to do it differently. And then that training is going to be adjusted to your learning abilities and cognitive skills. So a thing I do with this a lot of times, if people are having, say, a certain activity that may be like getting dressed, that's taking you way longer than you feel like it should, and it's making you run late, time yourself the next time you do it when you don't have to be somewhere in a rush, and just see how long does it take. Often for people with Parkinson's, it takes a lot longer than they're allotting. So if you give yourself that extra time, hopefully the thought is you won't get anxious, tremor, all of those things that kick up, cognitive, confusion almost when we get really anxious. So this can help a great deal. All right, so let's look at attention. And when we're talking about attention, it's the ability to selectively focus. So it's like you're picking what you're going to focus on in your environment, but then you also have to kind of ignore other stimuli, right? So it's a little selective there. So there's a lot of things about Parkinson's that impact your attention. So with your vision, there's that figure ground. So really discerning what you're trying to see versus all of the background, right, around it. There's oculomotor control issues sometimes so tracking and movement with the eyes. That's actually based on your dopamine as well. One of the loops in the brain is affected with that. The slower movements that you have, right? Those slower movements a lot of times impact maybe turning your head or you're, visually paying attention. That slower thinking can also, it's like difficulty following a conversation, even with auditory attention, things like that. Contrast sensitivity. So dopamine is part of the color vision system. And so a lot of times contrast isn't seen as visibly. So then if you're trying to pay attention to something visually and you can't see it as sharply, that can be a problem. And then multitasking, of course, can really impact this. If you're trying to do a couple things at once, it becomes a lot easier to miss what you're actually focusing on. Same thing with auditory attention. So that's hearing, right? It's discerning the person that you're trying to hear in a conversation from the background noise in the restaurant, right? It's easy for people to get auditory overload. If there's a large group conversation or a lot of background noise, that's all competing stimuli for what you're trying to pay attention to. Once again, that slow thinking, the Brady Bunch here, that can impact, following a conversation, like I said earlier. Some people have reduced hearing sensitivity, and that can be, we think, part of Parkinson's. I've seen it in some articles. Sometimes they miss it or don't mention it. And also with aging. So, 6 of one, half dozen of another. And then also multitasking as well. So if you're trying to maybe pay attention to 2 different people, then you've got a lot more impact and barriers to your attention. So some strategies here. I know a lot of these probably seem very rudimentary, but we don't do them. Reducing distractions. So, if you can meet up with that other couple, maybe in a quieter restaurant, or maybe you decide to meet at someone's home instead, so you can control the noise level a little bit. If it's just you at home with your loved one, maybe no television during dinner or watching music if it's a distraction. It's really important to eliminate clutter and organize your spaces. I'm going to start to sound like some type of house organizing guru by the end, but this really does impact your attention and your ability to attend. And then limit your focus, avoid multitasking. Try to complete one task at a time if you can, if possible. Once again, take breaks. That cognitive fatigue can really come in and it becomes more difficult to pay attention for longer periods of time. And then there's some suggestion that mindfulness could even help with this, because that ability to remain in the present moment, then we're not distracted by our own thoughts. Because how many times have you maybe been listening to someone, even a webinar, maybe right now with me, and you start thinking about something else, and you're like, wait, what did she say? So that ability to stay present and that mindfulness training, I think, can really help that a lot as well. And then let's get into memory. And it's important to know, when we think about memory, a lot of times, and I've dealt with this so many times when I have to talk to families about cognition, we're not talking about, with Parkinson's, the ability to remember your family or remember who your children are. This is very, very different from Alzheimer's. And even if it goes into a dementia presentation, it's still very different from Alzheimer's. So we're going to talk more about working memory. So that's that process of kind of temporarily storing information and then manipulating it over a short period of time. And so one aspect of this could be perspective memory too, where you're looking to do the appropriate action in the future. Working memory could also be, remembering maybe where you just set your keys or what you were going into the kitchen for. So it's that kind of in the moment memory. So this study looked at creating what they called implementation intentions for perspective memory. So they asked people first, what do you have to do? So specifying the action. So this could be taking your medications or doing your exercises. Typically it's something that we need to remember to do sometime in the future. Where or when do you have to do it? So they really wanted people to be concrete about the situation or the place where this would happen. And then they had them develop an intention statement. So when situation X arises, I will do Y. So they give the example here of when I eat breakfast, I will take my medication, or after lunch, I will do my exercises. And sometimes we call that chunking. So it's kind of putting two tasks together to kind of help you to remember them. They had people do kind of a mental rehearsal part with this study though, where they repeated the statement several times, either aloud or to themselves, just kind of, you know, when I eat breakfast, I will take my medications, almost like a little mantra. And then they actually had people do a mental rehearsal where they visualize themselves encountering the situation and doing the action in the future. If any of you are musicians or athletes, you may have done mental rehearsal before. It does not work for everyone. I had some people that really took to this, and I felt like a lot of times they were musicians or dancers or athletes, people that had used that mental rehearsal component. But still, you can even just use the chunking part of this if you like that, of putting the two tasks together. So some different memory strategies. So we're talking about internal memory strategies. These are ones that go on inside of us, you know, the Post-it notes and external strategy. So really paying attention and sometimes repeating, and I'll do this a lot with my keys. I'm not gonna lie, I'm putting my keys in the desk drawer, you know, saying it as you do it. So you help yourself remember it. Rehearse and repeat the idea on your way to the task. So I'm going to the kitchen to get the scissors, you know, whatever it might be, kind of repeating that. Chunking, I just mentioned, where you kind of group tasks or numbers or words together. That's how we remember phone numbers, right? It's that that chunks of numbers that we do. You might try to take a mental picture, really see yourself in that moment if you're someone that's very visual. You can make associations, and I'll give a fun example of that in a minute. You can create an acronym. I'm going to the store to get carrots, apples, and tomato. CAT. When you get to the store and maybe you're like, okay, I got the carrots, I got the apples. Wait, oh, it was T. T's for tomatoes. And then get organized. A place for everything in its place. This is really going to help avoid, you know, external confusion. And then also utilizing some external aids when you need. And I think these are familiar to most of you. You know, there's a lot of different options: whiteboards, planners, phone reminders, Post-it notes. Alexa will, I think, tell you to do just about anything now. So you have a lot of options for ways to kind of back up, right, your memory and have some supports in place. And this is an example of making an association. So it doesn't work as well when we're on Zoom because my name is clearly on the screen, but you guys probably all remember this lovely lady, right? This is Julia Roberts. So if we're at that party and you want to remember my name and I say my name's Julia, then you can think, oh, like you can think to yourself like Julia Roberts, or in my case, I think it's a little bit more like Julia Child, honestly, but whatever it takes, maybe it's your cousin Julia, but some way to really sink that in. And I had the cutest experience. There was a client at our clinic that said to me one day, he had had a fall and it ended up in the hospital for a few days. And I was coming through and he goes, Julia, I've got to tell you. He said, I remembered every nurse's name while I was in the hospital. And they were so surprised. And I said, how'd you do it? He said, I did what you told me. I associated it with something. And he said, and I would say their name when they walked in the room. And it was funny that just that little thing too made him so proud of himself. And also he said, then they didn't doubt that I was with it, which I thought was really cute too. He felt like it made him seem more together. So language is another area that can be a problem with Parkinson's. And this can be anything, generating words, naming an object, comprehending what you're hearing, verbal concepts. But the place that this comes up most with Parkinson's is that word retrieval or word finding issue. And so people, a lot of times it's called tip of the tongue syndrome. So they'll have difficulty finding the right word in conversation. It's also in the research too that often people with Parkinson's use simpler language. And sometimes this stands out, especially if someone maybe had very complex language or very academic before and the language starts to get more simple. Also, people with Parkinson's tend to speak less overall. And that's also why I think maybe the social engagement and things are important to get people out and get you social and get you communicating. So some strategies here for word retrieval. Number one, seek assessment and treatment by a speech language pathologist. They can really work with you and your loved one on some strategies about working together to help find these words. So maybe cues for the care partner, because we know cued recall for people with Parkinson's is a lot of times spot on. Like you might be trying to think of, that a cow, and you're like, it's, a big animal. And the person says farm animal, and you're cow. So a lot of times just giving a little cue can really help with that word retrieval. So you can also try to use a word with the same meaning. So maybe just coming up with a synonym. Can gesture. I do that a lot, obviously, when I talk, to trigger memory of the word. Maybe that's what I'm actually doing. Describe as much as possible as you can about it. It's a large farm animal. They can be brown with spots. Sometimes people milk them, whatever it might be. Try to recall the first sound or letter of the word. It starts with a C or sound. Sometimes trying to write the word or draw a picture of it can be helpful. The big one here, take your time. Try not to pressure yourself. I gave you that example earlier of trying to open the window in the computer and getting the spinny wheel. What happens if we get frustrated and we just click, 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 click? Now it really slows it down because all these windows are trying to open. So try not to pressure yourself. Really just stop, say, give me a minute, it'll come to me. But don't beat yourself up. And then there's that last one of drawing a picture or visualizing the word. Oh, here, and identifying a category. So it's a farm animal. It flies in the sky, whatever it might be, kind of giving some clues. And then that can help the person cue you in and help cue you in as well. Visuospatial function is one that's not talked about a lot, but this can be a huge problem. So this is the ability to kind of provide a spatial map of the environment. It tells us where things are around us in space, and it also involves our sense of direction. And so I made a note here of an example I wanted to give here too. So this could be giving someone directions to your house by tracing the route in your mind, avoiding different obstacles in your path, and even, putting together a puzzle. So things that I would hear often as a clinician is, people with Parkinson's will sometimes set a clear glass too close to the edge of a table. And I mean, if you think about it and you look at that, it's like a bubble. So if we're having visuospatial problems, seeing where that is in relationship to the table can be very difficult. Sometimes people perceive things to be closer or farther away than they are. I have a good friend that when his medications go off, he feels like everything has gotten way closer to him. Sometimes people will bump into furniture or walls because they're not really aware of the space or distance. Trouble estimating distance to a chair. So we'll see people approach sometimes to sit and be reaching for the chair long before they get there. And you'll notice often this is related to gait dysfunction or troubles walking and moving, and also freezing of gait. So if you have any times where your feet feel stuck. And then difficulty judging distance and space when driving. So a lot of times executive function and visuospatial function are what cause problems for driving for people in Parkinson's, not really so much tremor or motor problems. So some strategies to support your visuospatial function: use as much contrast in your environment as you can. Like I said, this glass takes on anything it is, but if I compare that to this big white cup, I can really see the big white cup better, right? So try to have as much contrast in furniture, in dishes as you can. Provide visual targets. So a coaster, something that gives a target. A brightly colored one would be better. So if I was looking for a coaster for my loved one, I'd be going for something more bright orange or yellow or red so that they can see where they should put that cup, where they should put that dish. Utilize glasses or dishes or furniture, blankets, pillows with color so you can more see where chairs and things are in the environment. Use colored tape or decorations for visual contrast. So I've had people put a strip of colored tape on a chair so the person can more see where they're going to sit. But I've also had people use a colored, like a pillow or throw if they don't want tape on all their furniture. And then ensure that the lighting is adequate. We really can't, have good visuospatial function if the lighting is not good. So then I want to lastly talk here about dementia before we go into brain health. It's not a specific disease, and most people don't know that. It's a general term for impairments in the ability to remember, think, or make decisions. And this is the key part that interferes with doing everyday activities. So it's when it's to the point that it's impacting your function and your independence. So this is an important thing to note too, with Parkinson's disease and dementia. You know, there's an umbrella here. Really, if you have had Parkinson's for some time and it develops into dementia, you actually have a type of Lewy body dementia. If you have dementia, if you have, dementia with Lewy bodies, it also falls under the LBD umbrella. So this confuses a whole lot of people. And it's in this timing of this 1 year rule. So in Parkinson's disease dementia, you're going to see changes to movement first, and then the onset of those significant cognitive changes happens over time. And this doesn't happen to everyone with Parkinson's. In dementia with Lewy bodies, you're going to see changes to cognition first or at the same time as movement changes. So a little different presentation, but both have these protein deposits called Lewy bodies in the brain. So once again, what do we do? This is so important. This was a study out of the UK where they looked at goal-oriented cognitive rehabilitation. Because remember, we talked about not trying to restore function, but really looking at how to keep people engaged and doing what they want to do. So they had people set goals of things they wanted to be able to do in their daily life, and they worked on that. That was their cognitive rehabilitation. And they showed that that was actually superior to treatment as usual or relaxation therapy for both the individual with Parkinson's and the care partner. So it really showed that the person becoming more engaged, being able to do things that they wanted to do, helps not only the well-being for the individual, but also for the care partner. So really important that we not give up just because someone has dementia and not support them in doing things they want to do. You can also look at cognitive stimulation. So this is when we're, engaging in these social or maybe different activities, but that we're not trying to focus in and improve one element of cognition. It's just really stimulating the brain. So group discussions, book clubs, maybe games, trivia, music-related activities, but it's really keeping the person engaged, active, and stimulated. So here's some strategies, if you are experiencing dementia. Like we said earlier, try to establish that familiar, consistent daily routine. So important to know what's expected. You want to work on having gradual transitions. So what does that mean? Maybe it's Tuesday and it's your day to go to physical therapy. So then talking about that in the morning, maybe over breakfast. Today's the day we're going to go to physical therapy at 2 o'clock. And then talking about, maybe overtime, oh, it's noon. We've got, we've had lunch. We got to get ready after lunch to go to physical therapy. So looking at gradually transitioning, not, oops, it's 2 o'clock. We're supposed to be at PT. You want to give a little bit more warning. Utilizing music can really help with this. So if you have, I had some clients that we'd have a certain song. I had one gentleman that hated to shower, but he loved opera. So guess what? We started playing opera. He would go get in the shower and sing his opera while he was in the shower. So that can really help people. They have a song for when you go to PT or a song for doing a task. It triggers the brain that like, oh, it's that time. Coach frequent reorientation. So if the person is confused or disoriented, don't argue, but just kind of, oh, yeah, today, remember it's Tuesday. We're going to go to PT today, or we're going to, have FaceTime with the grandkids or whatever it is, just kind of bringing it back. Schedule contact with family and friends. I think keeping that connection via phone, video, in person, however you can really help. This is very helpful too with Capgras syndrome, which can happen in Parkinson's, where people start to have trouble recognizing their loved one. So having that scheduled contact and something to look forward to where you really orient to your family and your surroundings can be helpful. So important to keep meaningful hobbies and activities going. There's a lot of research that, people can keep doing, exercise, arts and crafts, things that they enjoy, even with dementia. It's just sometimes they can't attend as long and they might need more support for doing the activity. Store belongings in a predictable, familiar place. So there's kind of that place for everything again, so people know what to expect, or if they're looking for something, where to find it. You can mark items with pictures instead, so kind of an idea of what something is on the outside of it. Maintaining a highly visible calendar and discussing that calendar and knowing what to expect for the day. Oh my gosh, there it is again, decreasing clutter and distractions. So you really don't have all of that confusion in the environment. And then establishing cognitive stimulation activities that are enjoyable. This really does help with quality of life, seems to help with a lot of the behaviors around dementia. So important, get an OT in there and find what you can do to really stay engaged. So then getting into these brain health activities quickly, I want to get through these. Guess what? Exercise on cognitive function. So consult with a physical therapist, but they found that multimodal exercise where you're looking at aerobics, some strengthening, some flexibility and balance has shown some improvements in cognition. And then also tango dance. And I don't know if it's necessarily tango dance, but I think having to think and move at the same time and learn something different can really help. So they've shown some improvements that way. So I think get active, exercise, try something new. It doesn't have to be tango. Maybe it's fencing or, whatever it might be, line dancing. These are some different games and activities I've used, and I have a class called Fit Brains that I've done for many years now, and we do some of these activities too. SET has an online version. You see in the middle, there's a website you can go on to find. Life Stories is a great game to play too, of just and I like that one even for pacing sometimes. If you're training a family or as a family, you're learning to communicate with your loved one, seeing how long it takes them to answer a question, not answering for them or the conversation keep going, can allow you to really see that bradyphrenia and how much time you need to allow to give that person some extra time to communicate their thoughts as well. Sleep hygiene, so important. I'm not going to linger all of this, but you really want to focus on your sleep. If you're not getting good sleep, talk to your doctor. There's some maybe you need to see a sleep medicine physician, or, there's some evidence too on intensity with exercise with Parkinson's for sleep, but also looking at consistent sleep and wake times, getting at least 7 hours of sleep. So making sure your bedtime allows that. Having a bedtime routine that you repeat and do nightly, ensuring that your bedroom is dark, quiet, and relaxing, and a comfortable temperature. Get the TV out of the bedroom. I know I'm probably going to make some enemies on this call with that one, but it is not good for your brain, and it stimulates a part of your brain, that blue light, for up to 2 hours after. That can really, you might fall asleep watching television, but then your brain's more alert after. Avoid large meals, caffeine, alcohol, exercise regularly, but not too late in the day, right? We want to get that in a little earlier. Use the bed for sleep and sex only, so no bill paying and solving the problems of the world in bed. And then reducing your fluid intake a lot of times before bedtime. And that's something to discuss with your physician. It may be what time you need to cut off liquids or how to approach that with taking your medications. And then I mentioned mindfulness earlier. I just want to touch on this a little bit more. It gets a little bit woo-woo, I think, in the press. Sometimes people think you have to meditate or, be a Buddhist monk, but it really is just that act of being intensely aware of what you're sensing and feeling at every moment without judgment. It's that simple. You can brush your teeth being mindful. You can eat and be mindful. You can walk and be mindful. You don't have to sit in lotus position to be mindful. And this study looked at mindfulness intervention tailored for Parkinson's. They showed not only reduced anxiety and depression, but also they showed improved cognitive and motor function. And think about it. Those of you that have maybe done physical therapy, what do they ask you to do, right? Okay, I want you to focus on taking those big steps, really focus on lifting your feet. So much of it is really focusing on and being mindful of how you're moving. So it makes sense to me that we would see those improvements. They showed improvements in working memory and verbal fluency, and the gains were maintained at a 6-month follow-up. And the authors felt that this suggested that mindfulness could serve as a form of cognitive training. And I have to say, for me, I've practiced mindfulness for a very long time, and I fall off the wagon and back on at times. And when I'm practicing it, I definitely do notice more of a mental clarity, because I think my brain is more able to shut off all of the clutter and distractions that come in. So in summary, discuss any changes to your cognition with your family and your healthcare team. Sometimes they might just be subjective. Sometimes there might be more they can do about it, but don't be ashamed. It's nothing to be ashamed of. There's a cognitive loop in your brain too. So it's all just part of Parkinson's. But then exercise your brain, stay physically, socially, and cognitively active. You guys are all here on this call, so I know you're probably doing all of those things. And then seek out an OT to learn strategies. So if there's something that you're having trouble doing that's meaningful to you, go see an OT and tell them, hey, I want to bake that cake or build that koi pond or whatever it is. And then also challenge your brain, explore new activities. Don't be afraid of things. Try something new because it's good exercise for your brain. All right, so there's my email. If anyone wants to reach out to me, you're welcome to. Thank you so much for your time and attention. And I put my references if you want them, and then I'll stop share. Okay. Oh, Judy, you're on mute.
I know, I'm on mute. Julie, that was wonderful. Thank you so much for all of that great, so succinct and well-organized information. We've got a few minutes. Are you up for some questions?
Absolutely. Let's do it.
Okay. This one I think is really applicable if to everybody probably that's watching. Do recommendations for cognitive health apply to folks having cognitive problems who don't have PD?
Yes. I was just on a call earlier. It's funny you should say that. And it was a group where we were talking about a manual we're doing for dementia. And what's interesting is, brain health, there's even a program right now that they're piloting in high schools to get students thinking early on about their brain health, and I think it's something that we all have to start thinking about more. Is even when we're younger. And I know my daughter, I have a 12-year-old, and she's really interested in all of this stuff. And so talking to her about her exercise, about eating well, about, when she kind of gets frustrated with something in school, I'm like, remember, it's a brain exercise. You might still hate, doing that 6 months from, but still you worked your brain out. So no, I think it's good for anybody at any time. It's never too late to start.
That is great. I'm not surprised. We worry about our heart and our lungs and our liver and our kidneys and our skin and everything. And then we just think the brain's supposed to kind of just roll along. So,
exactly.
Yeah. Okay, here's another one. How do you deal with a lack of motivation?
Oh gosh, that can be so hard. And I think you guys, the lack of motivation, a lot of times, you have to look at a few things. Is there depression going on? Because sometimes that lack of motivation can be part or parcel of depression. Apathy is also part of Parkinson's. So sometimes people really do lose interest in things. But I read something really interesting recently where a social worker, I believe it was a social worker, said that often apathy accompanies a loss of self-confidence in one's abilities. So think about it. If you don't feel confident doing something, like maybe you played golf, right? And now you don't feel confident going to play golf. Well, then you might seem like you're not motivated to play golf, but actually you just don't really feel comfortable, doing it. And so I think that a lot of times it's getting in there, number one, and finding out what's really going on. Is there maybe some depression? Are there some changes that way? But also, are there, things that person wants to do? What's really meaningful? I think that goal-oriented part cannot be underestimated enough. It's finding what's meaningful to that individual. I had a gentleman one time, what was meaningful to him, you guys, he wanted to mix his own drink. And the care partner was worried he would break the carafe. She had this crystal carafe. I was like, can we put it in something else? Because he wasn't drinking too much. The doctor said he could get his one drink a day. He was happy as a clam when he could just go and mix his own drink. So sometimes, and he had a lot of loss of motivation and different things, but I think he felt like there are a lot of things he couldn't do and a lot of things have been taken away. And keep in mind, that's one example. That's just one. So your example could be completely different. But I think look at the interest and motivation of the individual, look at what's getting in the way, and then how can you support? Like, what do they want to be able to do? Maybe that they're not able to do. But great question and not an easy answer. I'm sorry.
Well, thank you for those suggestions. We'll take a couple more. Here's one that I think is probably something that affects a lot of people with Parkinson's. Can sedation affect cognition for, say, 3 weeks afterwards?
Yes, Absolutely. Absolutely. Some of the Parkinson's medications, that have a sedating effect even can impact your cognition. And then also, I have to say, I've had a few surgeries in the last year and was sedated, and my cognition was off. Watch my World Parkinson's Congress presentation I did where there was some simple word I couldn't think of, but I'd had surgery 2 days prior. And I was still in a fog. So absolutely. And, keep in mind too, your baseline with Parkinson's, it might take longer for that to come back. Maybe before, if you'd been sedated, it might take 2-3 weeks. Maybe now you find it's more like 6 weeks. Still have that conversation with your doctor, but be patient, because sometimes I think it takes a little longer to bounce back.
Okay. And one more, can you exercise too much?
You exercise too much. Yes and no. So I think that it's all about a balance, right? And that's what we're finding. It's really, I think number one, don't exercise to the point that you ignore other aspects of your well-being. So I've seen some people come into the clinic before exercising like a fiend, but anxious as all get out. And so you want to make sure that you're giving yourself the space to address all aspects of your wellness. That could be anxiety, that could be stress management, it could be sleep, it could be social engagement, engaging with friends, maybe doing more cognitive activity. So I would encourage you, if you question, am I maybe exercising too much? Look at it and go, number one, am I enjoying it? I think that's first and foremost. Am I really enjoying what I'm doing? Are there other elements of my wellness that I'm not addressing? So am I not paying attention? You can look up the aspects, there's physical wellness, there's emotional wellness, there's social, occupational, there's all these different aspects, and you want to make sure you're well-rounded in those. So I think just do a little check-in, make sure you're enjoying yourself, and take care of your whole person.
Great, that's good. One final one, and I'm not quite sure. Well, let's see if I can make it make sense. Is, when people go in to see their doctor, their neurologist, movement disorder specialist, or whatever, time is limited. And so much of what that person needs to know is conversational. It's not poking and prodding, it's talking. Do you have any suggestions about how to frame questions and bring up things that are happening, behaviors or whatever, in a way that is short and sweet, to the point, and a good way to communicate in a limited time with physicians?
Absolutely. I encourage people to come in with your top 3 priorities for that visit. I would have them written down, or I would have them typed. Today I want to make sure I talk, and it doesn't have to be 3 if you don't have 3, but I would say, 1 to 3, this is what I really need to know about, or I really need to discuss today. And a lot of times doctors are really open to that, because it helps them kind of guide the conversation more. There are some great forms, you guys, too, in the Every Victory Counts manual, of, how to write your priorities down. I used to have people do those worksheets and take those with them. You can sometimes get a relationship with your doctor too. We had a few people at Penn that the doctor was like, email them to me like the day before, or send them through the electronic record, like the questions, and then they would come in with it ready to go for the visit. Like, oh, I was thinking about this. So, and I've got your 3 points here. So I encourage you, advocate to be the center of your care. And if a doctor doesn't like you doing that, you might need a different doctor because it's your care, right? It's your experience.
Well, yeah, and I want to add, there is the Empowered tool on PMD Alliance's website. And what's great about that is it has a list of different kinds of symptoms in categories that you'll relate to. And also it's just plain English. There's no Latin in it. There's no medical terminology, but it also, with the Empowered tool, you can keep track of your symptoms over time. And then also there's a form for better communication with your physician. And often the Empowered tool is also good for talking with each other in the home about what's going on. Sometimes the person who has the symptom or behavior isn't as aware of what may be going on, perhaps, as someone else in the home. And so it's an opportunity to kind of check in with each other and see what's going on and if you're on the same page with what you're noticing. So we have done it. We've done an hour and jam-packed full of wonderful, relevant, useful information. So for every one of us, you know, so thank you so much, Julia. Thank you to all of you that have attended, and we're so glad to have you. Keep it up. Come see us again real soon, and have a wonderful rest of your day.
Thank you,
everybody. All. Wave the Parkinson's PMD Alliance wave, and we'll see you next time.
Absolutely. Bye.
Bye.